Welcome back. Today we're going to talk a little bit more about ticks. In this video, I'll talk to you about how to prevent tick bites, what to do if you find one attached, and how to remove one safely. Prevention from tick bites is the best form of protection that you can get. Ticks love wooded, grassy, bushy areas. So if you're outside in Tennessee, these are the things that you need to do. Number 1, dress smart. Long sleeves, long pants. Tuck your shirt into your pants. Pull your socks over your pants legs. Your pant legs. Don't pull them all the way up to your belly. It's also important to wear light colored clothing because ticks are generally dark, so it's going to be more difficult to find them on dark clothing. You can treat your skin and your clothing with repellent. We're going to talk a little bit more about that next week because there is some controversy on the types of repellents that you can use, which one is safe and which one is not necessarily safe, in my opinion. And lastly, you can check yourself for ticks and your animals for ticks after you've removed yourself from the area of wherever you could have been exposed to them. It's very important to do a really thorough check, not just look at the outside of your clothes. I would remove those clothes, then check head to toe, essentially as much as you possibly can, because I have seen many patients that have thought that they've done a good enough check, but come to find out they did not, and they were actually inside of their clothing. So one of the things I really recommend is to remove that clothing, then check that way. Recently, actually, I had a patient who had been out in the garden doing some yard work. They did not take off their clothes, but they did a thorough check. They didn't see anything. They proceeded about their day. The next day they woke up and they had not 1, but 6 ticks attached to them. And we ended up having to treat them prophylactically with antibiotics to prevent a specific tick-borne illness in the region that they were in. So it's important to check thoroughly and accurately and make sure you take those clothes off. Some spots that can be a little trickier to identify ticks are scalp, armpits, groin, behind the knees, and in your waistline where your pants are, as well as your animals. Don't forget to check your animals, especially the dog ticks. Dog ticks can be transferred by dogs, aka dog tick. So don't forget to check your pets often. If you do find a tick, don't panic. No sense in doing that. You just need to be educated on how to remove it properly. And that's what I'm going to show you. First and foremost, alcohol prep. Clean the area where the tick is at. I don't know if you can see. I don't think you need to see. I can clean my hand, but in case you do. And I like to clean the instrument that I'm using, so I'm using some fine-tipped tweezers. I don't actually have a tick on me, so let's pretend. You're going to want to grasp the tick as close to the head and the skin as you possibly can. So gently grab, and then you're going to gently pull it up. Don't twist it. Don't jerk it. Gentle, consistent pressure, right? You want to get as close to the skin as you possibly can to where the tick bite is attached, where the tick is attached. So you get down close with the fine-tipped tweezers. You're going to grab it, and then you're going to pull up gently and steadily, but also a little bit firm. Like, you don't want to jerk it, but you also don't want to keep it in there, obviously. So you want to hold it at a steady pressure to be able to let it release. And eventually the little sucker will let go. After you remove it, clean the area really well, alcohol, antibacterial soap, and water. Then you're going to dispose of the tick. And I usually just do a plastic bag. It'll suffocate it. Some places in your town might actually be able to test the tick and see if they have any of the tick-borne illnesses that we worry about. In New England, that is a common thing that we actually recommend patients doing, is if they have a history of tick-borne illnesses or they're most worried about it, they'll take that baggie, drop it off at the health department. The health department will test them, and then they'll notify them if the tick was a carrier or not. Some things that you do not want to do, like I mentioned before, you don't want to take these little tweezers and rip the little sucker off, because a lot of the time you're going to leave the head in there. The CDC actually does say that it's not as big of a deal if you leave the head in there. You just really don't want to go digging for it. So that's another thing that you don't want to do, is dig around. If the head accidentally does get stuck in there, don't go digging for it. It'll work itself out. Clean it really well, monitor it for a secondary cellulitis or skin infection, and follow up with your provider if that happens. You also don't want to squish it with your fingers and let blood go everywhere. Just remove it gently, put it in the plastic bag, zip it up, take it to the health department, or don't. Put it in the trash. Doesn't matter to me. Just put it somewhere safe where that little booger isn't going to get anywhere else. Some other things that you don't want to do: don't light it on fire. Don't paint it with nail polish. And don't put it in some petroleum jelly. These are some common myth busters. Not really needed. Remove it. Plastic bag. You're good. Once you've removed the tick and cleaned the area well, you can mark the spot where the tick was so you can monitor for changes. However, if you have a tick bite in one certain spot, That doesn't mean you can't get a rash anywhere else. It actually is common for the toxins to be released in those tick-borne illnesses and rashes to be elsewhere rather than at the spot of the tick bite. So something that you need to keep in mind, and just monitor your symptoms closely for up to a month. Let's see. Yeah, within a month to 6 weeks, most of those tick-borne illnesses would likely have shown at that time. However, sometimes they are asymptomatic, meaning not 100% going to show symptoms. So if you're worried about it, give it a couple of weeks after the tick bite if you're asymptomatic, and then let your provider know and they may want to test you. Here is when you need to see your provider right away. Fever, chills, intense fatigue, rash, whether it's a spotted rash, especially on the palms and the soles of your feet, as well as severe headaches, muscle aches, joint pain, all super important symptoms that you need to watch out for, especially if you've been recently bitten by a tick. Remember, Rocky Mountain spotted fever can go fast and furious. So very important to watch your symptoms. Like I said, it is absolutely treatable, especially early on. So watch your symptoms. Early antibiotics can save your life. In summary, ticks are small, but they can be dangerous and even life-threatening. With the right prevention and quick action, you can stay safe. In part 3, we'll talk about long-term effects or complications of tick-borne illnesses and what a general recovery would look like. As always, don't forget to like, comment, and subscribe and share with your friends. See you next time.